Question number 1, why use yoga in the treatment of trauma? If you have watched any other videos that I have put out that cover impact of trauma on the functioning of our brain and nervous system, or if you have taken my Trauma 101 class, you know that one of the important goals in the treatment of trauma is rehabilitation of the functioning of our autonomic nervous system and different structures in our brain. So, based on that, there are some goals that we would like to address in the treatment of trauma. And those goals are restoring the function of the autonomic nervous system through expanding the window of tolerance and learning how to stay inside that window of tolerance as much as possible. Second goal, rehabilitating of the brain, and more specifically, calming down hypersensitive amygdala, regulating function of thalamus, regulating the function of the emotional brain, and also building new neuronal pathways or strengthening existing pathways between frontal lobes and emotional brain. So those are goals based on neuroscience of what we know about trauma. There is another goal that we can add to the list, is forming new positive connection with your own body, and also learning how to control different body sensations and emotions. So one of the best ways known today to reach those goals that I just described is through the regular practice of yogic tools, including mindful movement, breathing techniques, guided meditations, and non-judgmental awareness of body sensations, emotions, and thoughts. All of those techniques will be taught and practiced in my Yoga for Healing Trauma class. Moreover, I will rely both on ancient yogic tradition and latest Western research in delivering content in this class. So as far as yogic tradition goes, we know that for the past 3,500 years, yogis have really developed and fine-tuned lots of different tools for keeping mind and body healthy. And we will be tapping in the richness of this tradition. On the other hand, Western research, especially in the past 15 years, has shown that regular practice of yoga in the treatment of trauma leads to reduction of PTSD symptoms, including chronic symptoms, reduction of anxiety, stabilization of mood, improvement of self-regulation, and improvement in the quality of life. So this is why we would like to use yoga in the treatment of trauma. Now,